Please note, this training video reflects the MacPro system as of March 2016. So now let's go back into the system to take a look at creating a submission package with an amendment to a Health Homes program. Some of the steps will be familiar as they remain the same for all submission packages that are created, but some steps will differ from when we created a new Health Homes program. To get started, log into MacPro as the state editor. And like last time, select Actions and then Create Submission Package. All submission reviewable units are required like they were the previous time we created a submission package. Let's quickly fill out the submission summary reviewable unit and then continue to the submission state Medicaid plan reviewable unit. First, select View All Responses. As you may remember, this saves us from clicking open each of the sections within the page. Then indicate Not Viewable to Other States. And this time we are going to create an official submission because this is a rather simple change of an amendment. If your amendment was more complicated and it was something that hasn't really been implemented previously, you could submit it as a draft, but we're doing a relatively simple amendment, so we're going to submit it officially. Then add a key contact. Unlike when we created a draft submission package, we will next enter a SPA ID. And we're just going to put in a SPA IDs beginning with IA-16-546-T. And we will need to return here later on to update the proposed effective date portion, as you can see in the message on the screen that reads, "Please complete submission Medicaid state plan, then return to this section to enter the proposed effective dates for the reviewable units." Next, complete the dependency description. But whoops, we need to put in a summary first. I skipped right over that. So we're going to enter summary, then we're just going to enter description into the dependency description. Then we're going to enter no, for this is not a disaster-related submission. And I know we've seen this before. We're just going to go through this. It's slightly different than when we did the draft. We're going to put in the year. We're going to put in 2014. And then that will auto-populate 2015. We'll put in 100,000 for 2014 and 110,000 for 2015. Then finally, enter the federal statute for the federal, and we're going to enter just federal statute and no comment. For Governor's Office review, even though this is atypical for an amendment to a Medicaid Health Homes program. As a reminder, this is the training environment and the information we are entering is for training purposes only. We are making some selections to stay efficient with our time. Now that we are finished with the exception of the proposed effective dates, let's save. And again, we cannot validate at this time because we need to enter the proposed effective dates in the future. This reviewable unit is the only reviewable unit that you must return to after completing another reviewable unit, which is the Medicaid state plan. Once the Medicaid state plan reviewable unit is complete, you can then return to this page to validate this page. So let's now move on to the Submission Medicaid State Plan Reviewable Unit. At this point, we indicate that we are planning to amend an existing Health Homes program. We then can select from a list of Health Homes programs. And these are just a list of Health Homes programs that have been created. And we're going to select Health Homes Training Program 2. Next, select the Health Homes reviewable units that you will be amending. If you remember back to when we created a new Health Homes program, if you remember back to when we created a new Health Homes program, we completed all submission reviewable units and Health Homes reviewable units. Since this is an amendment to an existing Health Homes program, we will complete all submission reviewable units because those are specific to each submission package that we will send to CMS. However, we have the opportunity to select which Health Homes reviewable units that we will be amending. For this training, we will be amending Health Homes payment methodologies and Health Homes geographic limitations. The reviewable units table includes a series of checkboxes allowing you to amend multiple reviewable units at once, or as little as one reviewable unit within your submission package. The right-hand column of this table lets you know if this reviewable unit is included in another submission package. This is important for version control and can be used for your reference. We will look into this in a little bit more detail in the PowerPoint. So you know it is possible to start drafting a submission package while a reviewable unit within the program is included in another submission package, although it's best to do one at a time. The reviewable unit information is pulled from the most recently approved version, and we're going to look at an example with this in a little bit more detail once we return to the PowerPoint. So now that we've completed entering information on this page, make sure that yes is selected to validate, and then select Save Reviewable Unit. The Submission Medicaid State Plan Reviewable Unit is now in the complete status. If we go to the Navigate to Reviewable Unit drop-down list, we see that our list includes all submission reviewable units and the Health Homes payment methodologies and geographic limitations reviewable units that we had checked off. If you decide before submitting that you would like to amend another Health Homes reviewable unit within this package, you can do so by updating the checklist and saving on the Submission Medicaid State Plan Reviewable Unit page. This action will update the options available in the Reviewable Unit dropdown. You also have the ability to view any of the currently approved information in the reviewable unit by selecting the reviewable unit name. This populates the information in the space below the table for your reference. So if we click that, we'll see that some of the information will become available for us, so we can take a look at what that looks like. So now let's go to the Health Homes Payment Methodologies reviewable unit that we will be amending by going to the bottom of the page and selecting Health Home Payment Methodologies, and then go to Selected Reviewable Unit. If we select View All Responses, you will see that the reviewable unit information has been populated from the original Health Homes plan. We are going to update the explanation for the rate development. And we're going to enter into the box an amendment addition. Now that we've updated the reviewable unit with our new information, let's scroll to the bottom of the page and select Yes for validation and Save Reviewable Unit. This reviewable unit is now in the complete status. We're going to return to the Submission Summary Reviewable Unit to update the proposed effective date for the reviewable units that we are amending. So select the Submission Summary Reviewable Unit in the drop-down list. The Submission Summary Reviewable Unit, there you go. And go to Selected Reviewable Unit. This reviewable unit page will need us to select the plus or minus sign for the SPA ID. As you scroll down, we're going to go to the SPA ID and effective date. And we're going to select some different dates for the Health Home Geographic Limitation and Health Home Payment Methodologies. We're going to select a future date for both of them. So we're going to say tomorrow. Now that this is updated, let's select Yes for validation and Save Reviewable Unit. Next, we're going to go look at this page. You know what? Let's scroll to the top of the page. It looks like we might have some validation error. So if there's a validation error, you're not going to be able to validate or save your page. You're going to have to scroll towards the top of the page, and there will be something in red showing you if there's something missing. So we're going to select No, scroll to the bottom of the page, and try and validate again. This time, our timeline is now in the complete status. So next we're going to go look at this package in the Records tab. We're going to scroll down to the submission packages for our state only, and the package that we just created, which ends in 546T for the SPA ID, and it's towards the top of the page. It was created a moment ago. We're going to select that. We're taken to the package summary page. This should be familiar from earlier in the training. Select Reviewable Units on the left-hand toolbar. And notice that there are two reviewable unit tables. One for submission reviewable units, which are to be included in every submission package, and another for Health Homes reviewable units. And this table changes depending on the type of submission package being created. We skipped some of the reviewable units for the sake of time during today's training. And within the Health Home SPA reviewable unit table, there is the Health Homes Payment Methodology reviewable unit and the Health Homes Geographic Limitations reviewable units. This is in the complete stage for actually one of them, and the other one is not started. Additionally, there is an indicator for if there are other approved versions. If we hover over the image, we see that the message that reviewable unit does not have another approved version with future effective date. You may use this information for your reference. It's important to remember that when you add a reviewable unit to an amendment submission package, you're pulling the most recently approved information regardless of future or past effective dates. Once all reviewable units are filled out, the state editor will be able to submit the package to the SPOC for review by selecting related actions on the left-hand toolbar. Then the process will be the same as we reviewed earlier. The SPOC will review, the state director will review and certify, and the SPOC will submit the Health Homes Medicaid State Plan Amendment to CMS. So let's move to the PowerPoint to review what we just went over and to go over a few other examples before returning back to this training environment. So we just reviewed how to create an amendment in the MacPro system. As we saw in the system, you may select reviewable units within a program to amend in a submission package. Unlike a new Health Homes program, each reviewable unit in an amendment may have different proposed effective dates. Additionally, if a reviewable unit is included in another submission package, we encourage you to wait for that submission package to be reviewed and closed prior to submitting another official submission package with an amendment to that Health Homes program when possible. Finally, like we discussed in the system, when you add a reviewable unit to an amendment submission package, you are pulling the most recently approved information regardless of future or past effective dates. So when you add a reviewable unit to an amendment, it pulls the currently approved information to that unit. The indicator on the right lets us know that the Health Homes Payment Methodologies reviewable unit is included in another submission package. Now, this example may be more common for the population and enrollment criteria or geographic limitations reviewable units. This indicator is important because if we do not include the other amendment information in this particular reviewable unit, there is a potential to overwrite the other information that's not currently in this submission package. So at this time, we have the currently approved information as of, we're going to say March 4th, included in the Payment Methodologies reviewable unit, the date that we added this reviewable unit to our amendment submission package. Again, this is March 4th. While we were working on our amendment submission, the other submission package that was indicated in the table on the previous slide was approved. As a reminder, there was an indicator because the second package also included the Health Homes Payment Methodologies reviewable unit for that program we are amending. The other submission package was created on 3/3/2016. the day before we created our submission package, and it was approved on 3/10/16. So when we had the indicator showing on the previous slide, that was created on March 4th, and this package was created on March 3rd, which is why the indicator was showing up. It held the same reviewable units, and this one was just approved on March 10th. If this scenario were to occur, the state point of contact would receive an email notice from MacPro to alert them of the situation. As you can see, the indicator in the reviewable unit in the submission package that we're working on as of 3/10 is no longer shown. And we've been working on this since it was created on March 4th. We want to make sure that we have the most recently approved information in this amendment so that we do not overwrite the newly approved information in the payment methodologies reviewable unit of this Health Homes program. So let's assume that we have not begun editing information in this reviewable unit yet, and currently we have the information that was approved as of March 4th, when we added this reviewable unit to our submission package. Therefore, the information approved on March 10th is not included. Since we have not worked on anything in the reviewable unit yet, we will remove the Health Home Payment Methodologies reviewable unit and save. This removes the Health Home Payment Methodologies unit from our reviewable unit list to complete. We will then re-add the Health Homes Payment Methodologies unit to our submission package, which pulls the most recently approved information as of today's date, which includes the information that was approved on March 10th. This re-adds the reviewable unit to the drop-down list for our completion. And if we navigate to the reviewable unit, we see that the most recently approved information that was included in the other submission package that was approved on March 10th is now available. As a note, the steps we just completed would remove any new changes you may have made to the reviewable unit prior. I suggest you consider if it's best to follow these steps and re-add in your information, or if it's best to write in the newly approved information from the other submission package. I would weigh this to see if the newly approved information would take you longer to type in than what you had already put in as your new changes in the amendment you're currently working on. So I know that was a little bit confusing. I'm going to pause right now to see if there's any questions before we move on to looking at a few other logistical things in the system before we move on to reviewing the help desk information. So we're now going to go back into the system to look at referencing your Medicaid state plan and how to pull MacPro reports. So now let's go over how to review your Health Home State Plan record. We're going to go to the Records tab and select Medicaid State Plan, which is right there in the middle. And we're going to search for Iowa using the search function on the left-hand side of the screen. I personally don't like to scroll very much. And there we have Iowa. And from here you can see subsections within MacPro and their associated programs. If you'd like to view specific reviewable units by effective date, you can do so by going to the related actions on the left-hand side. You then have the option to select View Current Approved Version or View Approved Version by Date. Since we did have a question about this, we're going to select View Current Approved Version just to go into a little bit more detail. We're going to select Benefits. Then we're going to choose Health Homes Program. And again, we're only having one subsection at this time because Health Homes is the only one that's in the system. We're going to hit Next. And then you can see we have one program, so we're going to select that. And here you can see the most, all of the Health Home units by today's date. If we were to use the other option in the related action, we could view the reviewable units by specific approval date. And these, what we're currently looking at are what is approved and effective, and the other option will look at specific dates. So now let's look at how reports work in MacPro. So we're going to begin by selecting reports at the top of the page. This is the first time we've gone to this reports page. Then let's take a look at the submission statistics detail report. As you can see below the link, this is the report that will allow you to view all submission packages currently in review. And we're going to select some links to pull information. We're first going to enter a range of submission dates to pull reports. So we're going to filter for dates between February 1st, 2016. So you can either type in the date or use the calendar depending on what's more convenient for you. And we're going to go with today's date, so we'll stick with March 22nd. And then we're going to select Iowa only and Medicaid only. And this is helping us filter our information that's in the table below. Then we're going to see what we have listed here. And as you can see right now that it's being filtered by the start date. If you look at the start date, you see that there's a little arrow pointing down. If we select end date, we can then choose to filter by the end date. So we also have the opportunity to export this information. So let's go and select Export to Excel. And you can see that this export was initiated, and you're going to shortly receive a task with the link to download your report. So let's go to the Tasks tab and select Download Link for Submission Statistics Detail Report. We're going to select the link and open the information. You're going to have to give us a second so we can size it with our closed captioning here. Just want to make sure we're not covering that up. And as you can see here, we're just going to give you a quick view that this information could be used however you may wish, and you can use all the powers of Excel to do any filtering to make this report work for you. Then let's return to MacPro. And once we're finished with this task, we can select Close. And this task will stay in your to-do list or your task list until you select Close. Now this is the end of our in-system portion of today's training. So stay with us. We're very close to being finished. So we're going to return to the PowerPoint. And we reviewed in the system how to look up your Medicaid state plan. It is possible to review the currently approved and effective version of the state plan, and you can also view approved versions of the Medicaid state plan by date. Then we looked at how to pull a report in MacPro. This slide includes the reports available within MacPro for certain state users. We reviewed how to access the Submission Statistics Detail Report, and each of these reports functions similarly, but pull different information for your reference. Technical assistance will be available to MacPro users. For issues related to MacPro access and how to use the MacPro system, contact the MacPro Help Desk at macpro_helpdesk@cms.hhs.gov or call 301-547-4688. To help expedite an answer to your request, here's the information that should be provided in an email request to the help desk. Your contact information, the application you are using, in this case, MacPro Health Home Spa. Give a detailed description of the program, including how many people are being affected by it. Not the program, the problem. A detailed description of the problem. Specify the last screen or activity that was performed before experiencing the issue, and include the error message that appeared, and preferably a screenshot. MacPro works best with certain internet browsers, and we encourage you to reference this slide in preparing to use MacPro. And here's a reminder of your next steps. Your state should return the MacPro Rules template to the MacPro Help Desk. You'll receive notifications including your MacPro information once the rules templates are processed. Finally, look out for the MacPro Health Home Spa release announcement. So this is the end of our demonstration today. The next slides in the PowerPoint include appendix information for your future reference.